To the West Asia, where a recent study has raised concerns that the true Palestinian death toll from Israeli attacks in Gaza is likely much higher than the figures reported by local health authorities due to factors like disrupted healthcare services and the spread of diseases. According to a statement released by the Gaza-based health authorities on Thursday, around 46,000 Palestinians had died and more than 109,000 others have been injured since the outbreak of the latest Palestine-Israel conflict in October 2023. However, a new study published by the London School of Hygiene and Tropical Medicines in The Lancet suggests that the actual death toll may be significantly higher. Here's a report.
An official Palestinian tally of direct deaths in the Israel-Hamas war likely undercounted the number of fatalities by tens of thousands as the Gaza Strip's healthcare infrastructure unravelled. That's according to a peer-reviewed study published in the Lancet Medical Journal on Thursday. Researchers estimated there were 64,260 deaths due to traumatic injury from Israel's air and ground campaign in Gaza in the first 9 months of the war, from October 2023 to the end of June 2024. That figure is 41% higher than the official Palestinian Health Ministry count for the time. The Lancet study said nearly 60% of those killed were women, children, and people over 65. It did not provide an estimate of how many Palestinian combatants were among the dead. The Lancet study said the Palestinian Health Ministry had maintained reliable electronic death records, but its capacity to do so deteriorated under Israel's military campaign, which has included raids on hospitals and other healthcare facilities and disruptions to digital communications. Israel says it goes to great lengths to avoid civilian deaths and accuses Hamas of using hospitals as cover for its operations, which the militant group denies. The war began on October 7, 2023, after Hamas gunmen stormed across the border with Israel, killing 1,200 people and taking more than 250 hostages, according to Israeli tallies. Palestinian health officials currently put the death toll of the conflict at more than 46,000 people. The Lancet study was conducted by academics at the London School of Hygiene and Tropical Medicine, Yale University, and other institutions. Anecdotal reports suggested a significant number of dead lay under the rubble of Gaza and therefore were missing from tallies. So, using data from at least 2 independent sources, researchers looked for individuals who appeared on multiple lists of those killed. This method, called capture-recapture analysis, has been used to evaluate deaths in other conflict zones. Less overlap between lists suggests more deaths have gone unrecorded, information that can be used to estimate the actual toll.